Hi, I'm Dr. Gary Breslow, Medical Director of the Breslow Center for Plastic Surgery in Paramus, New Jersey. A patient emailed me asking me what the difference was between an abdominoplasty and liposuction of the abdomen. That's a very good question. It's a question I get very frequently. And to understand the question, it's important to understand the different aspects of the abdomen, because the truth of the matter is that liposuction of the abdomen treats a completely different issue than an abdominoplasty or tummy tuck does. The abdomen is made up of different layers. First you have the skin, then you have the fat sitting right underneath the skin, and then you have something called the abdominal wall. And the abdominal wall is a rubber band sheet that holds everything in place. It holds in place your abdominal musculature, the intestines, and so forth. Liposuction only treats the fat sitting right underneath the skin. And to the extent that there's fat sitting right underneath the skin, and that's the only issue, liposuction is very effective. Now there's different issues in terms of which liposuction is the appropriate treatment to use. But insofar as liposuction is used to treat that, it's very, very effective. The problem is that liposuction alone may not be the best treatment, because it may not just be fat that's sitting underneath your skin. You may have excess fat and excess skin. And if you have excess fat and excess skin and you do liposuction to that area, you will now only have excess skin, which arguably will look worse than the excess fat and skin, because you can end up with very wavy skin that's hanging. The other issue is that it's usually not just the excess fat and skin that's sitting there. It's also something called abdominal wall laxity. And what I mean by abdominal wall laxity is that the abdominal wall, which is the rubber band sheet that holds everything in place, gets lax. Well, how does it get lax? Well, a lot of times after pregnancy, for example, the abdominal wall, which is the rubber band sheet, gets pushed out from the pregnancy, and just like a rubber band that's been overstretched, after the baby is born, the abdominal wall, instead of coming back to where it belongs, it comes back to a more lax position. If you get pregnant a second time, it'll be overstretched again, and you end up with a lax abdominal wall, as well as excess fat and skin sitting on top of it. Excess weight loss can also do it. If you have excess, if you gained, or if you were heavy, the place where you have most of your weight is actually on the inside of your abdomen, attached to your intestines, and that's pushing out on the abdominal wall, just like a baby would push out on the abdominal wall. If you then lose the weight, the abdominal wall will come back, but because it's lost its elasticity, remember the overstretched rubber band, it won't come back to where it belongs. So what a tummy tuck or an abdominoplasty does is that actually takes the excess fat and skin, removes it, tightens the abdominal wall back to where it belongs, and then closes the skin on top in a tailored, tight fashion. So the truth of the matter is that an abdominoplasty and liposuction treat two totally different things. So that's the answer.